Today we are seeing one of our patients. She had a lower body lift and a spiral thigh lift about a month ago. I typically don't do spiral thigh lift with a lower body lift at the same time because there are two difficult procedures and it's a little bit tasking for patients to heal, but she's come from overseas, so we were trying to maximize on her stay here and the corrections that she needed. She had had a prior inner thigh lift that had resulted in scar migration and so forth, and we just needed to clean those up. So you can see her. I mean, the proof is in the pudding. She looks phenomenal, healing perfectly, hasn't had even one problem, which is kind of unusual. These are difficult surgeries. People develop minor openings, but she's been amazing and she's healing amazingly. So this is her lower body lift incision. You can see how beautifully she's healing. Only 29 days old. Healing perfectly. A great amount of buttock enhancement. It will go down. I'd like to do a little bit of overcorrection. So once it settles and some of it resorbs, then we'll end up with a good size. And I think for her, we're gonna actually end up with an amazing size once we get about 10 to 15% reduction of this, which could be swelling, which could be some of the fat resorbing and so forth. These are her spiral thigh lift incisions. You see how perfect they look. Again, she's healing perfectly. I place the incisions under the buttock cheek. I reconstruct the infragluteal crease for the patients. It's a procedure that we described in 2008, so I've done a ton of them. And it's not an easy procedure, and it's not an easy procedure to recover from. She needed it because she had had prior incisions that were placed here for an inner thigh lift that wasn't done perfectly. On the front, she's healing perfectly. We did a partial tummy tuck. She still is tight. She's still unable to fully stand up erect. This is her old navel. I couldn't remove all of that incision out, but you can see how perfectly, again, she's healing in the front, here, and here. And then her inner thigh incisions are here. You can see how perfectly we reconstructed her infragluteal crease, which is the crease underneath the butt, spiraling in the front and becoming the groin crease. And now those are completely corrected. She had migration. You see that scar? Perfectly reconstructed so that the mons area and the thigh areas are not on one plane. You want to have indentation of the groin crease correctly and fullness of the mons when you can. What do you think?
Perfect.
Perfect.
I'm very happy.
Thank you very much.